Do you remember, and this was just last week, when Dave Chappelle said this?
The presidency is no place for petty people.
Or vindictive, spiteful, or just downright ignorant, stupid, and rude. And, we had a lot of fun when Donald Trump during COVID said stupid stuff like this.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs. So it'd be interesting to check that.
And we all, to include myself, made fun of him. I mean, it's kind of dumb to think that someone would want to inject themselves with bleach to get rid of COVID. That makes no sense. Why would he say that? And because it was so bad and the reporting was getting worse and worse and worse and COVID was becoming a pandemic, he wanted to stop testing because the more cases that came up made him and his presidential legacy look bad.
When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please. They test and they test. We got tests of people.
And still, his presidency, or at least the first one, will be defined by COVID. But now he's back in the White House. And according to MSNBC and some of their reporting, you won't believe what he's doing. Because again, he wants to protect his legacy and he's being petty.
Washington Post reports this, quote, health officials and experts said this week they are reeling after the new Trump administration on Tuesday abruptly halted external communication at the Department of Health and Human Services and its agencies, including the Centers for Disease Control and Prevention and the National Institutes of Health.
The most effective thing a tyrant can do, one of the things, and again, I'm not saying he is this person. The one thing that Adolf Hitler did was try and control the narrative. And how do you do that? You do that with communication. You do that with the press, and you do that with what's being communicated out of your White House or out of your government. Donald Trump has stopped the disease control people from communicating with each other. Why?
When you do testing to that extent, you're going to find more people, you're going to find more cases. So I said to my people, slow the testing down, please.
As long as the National Institute of Health and the World Health Organization and the Center for Disease Control, as long as they're communicating, they're going to know what's next as far as what communicative diseases that are out there. And they'll be able to get that out to the masses. Trump don't want you to know about it because it'll hurt him if those diseases spread and become a epidemic or a pandemic. So what does it mean when he cut their communication?
Meaning things like meetings of scientific researchers, experiments, other sciencey stuff, it all stopped. Decisions about who to give grant money to for their work stopped. Travel for employees at HHS stopped. Communications that are relied upon to disseminate critical health information about ongoing stuff stopped. What happened this week?
There was also a report that's come out every week since 1960. Listen to the tweet from someone who knows what's going on with this certain report.
Former CDC Director Tom Frieden pointed this out yesterday. CDC's Morbidity and Mortality Weekly Report had provided real-time data and analysis about disease outbreaks and emerging health threats without a break every week since the year 1960 until today.
They used to get a real-time weekly report about disease in this country since 1960. We don't get that no more. But that is not all. They're literally cutting communications across the board when it comes to disease prevention, health, and all kind of studies, to include cancer research.
The Post spoke with Victoria Seawalt, Chair of Population Sciences at City of Hope Comprehensive Cancer Center, who was scheduled to lead an NIH study section Thursday that was abruptly canceled without guidance on when it would be rescheduled. The session was scheduled to review grants focused on cancers and other chronic illnesses. So as health research and money and communications are stopped, paused, Trump also cut off the U.S.'s access to global health data when he pulled the country out of the World Health Organization.
And again, why is he doing all of this? Why is he taking all of the health stuff, the studies and the meetings and the plane flights and the phone calls and the internet and the broadband? Why is he taking everything from the CDC, pulling us out of the World Health Organization, pulling us out of defunding the NIH? Why is he taking it all back? He wants to control the narrative. He wants it all funneled into his people so they can give it to him. He can do what he wants to do with it and then give it to the masses in his language.
This new administration wants Trump's people to monitor everything, including cancer research. A memo sent out by the acting HHS secretary, obtained by NPR, said this, quote, refrain from publicly issuing any document or communication until it has been reviewed and approved by a presidential nominee.
He wants only those people he nominate to give him the information because, he trusts them. But also he puts people, or he selects people that he can control, that he can get total loyalty from them. Even though they put their hand on the Bible they say they love and swear allegiance to the Constitution, they still have their fingers crossed behind their backs because to whom they're really pledging loyalty to is Donald Trump. Donald Trump is going to say that he is America and that you need to make him great again at the detriment to our health and well-being. The man could care less about how we feel just as long as he feels better than how we feel. What do you think?